Hello, my name is Dr. MaryAnn Lehmann, and I am part of the PEARL network. PEARL being practitioners engaged in applied research and learning. I'm an executive committee member, and I'm also a practitioner investigator for PEARL. I practice dentistry in Darien, Connecticut. This JADA author video describes the manuscript Dentin Caries Activity in Early Occlusal Lesions selected to receive operative treatment. Findings from the PEARL network, of which I am an author. The study began as an idea from PEARL network clinicians. The network developed the idea into a study design in collaboration with network dentists and academic researchers. The study was funded by the National Institute of Dental and Craniofacial Research. For background, the purpose of the study was members of the PEARL network investigated the Dentin Caries Activity in early occlusal lesions and its relationship to patient age, preoperative tooth sensitivity, radiographic appearance, and its influence on preparation depth and volume. The methods we used included that 45 PEARL network practitioner investigators, who are general dentists, were trained, but whose methods were not calibrated, conducted a study regarding postoperative hypersensitivity in resin-based composite restorations. The PIs enrolled as study participants 613 patients with occlusal caries lesions that in the PI's clinical judgment required restoration. The PIs used baseline radiographs to assess the depth and extent of the lesions. Data for 671 restorations included baseline sensitivity, ranking of dentin caries activity on the opening of the enamel, radiographic visibility, and measurements of preparation depth, width, and length. The results of the study included that the PIs found rapidly progressing dentinal caries in only 38.5% of lesions, and slowly progressing and potentially inactive dentin caries in the remainder of the lesions. Rapidly progressing caries was not related to the participant's age or participant-reported preoperative hypersensitivity, but was related to the lesion depth as seen radiographically and depth and volume of the preparation. Molars had only slightly higher, but not statistically significant levels of caries activity. As a restorative dentist who's been practicing for over 25 years, I was honestly surprised by the results of the study. It has really caused me to reevaluate my thought process and whether to restore a tooth or not. And my practice on a whole has taken a different approach to preservation versus restoration of what we thought were restorable carious lesions. In conclusion, we found that rapidly progressing dentinal caries, while present in only 38.5% of lesions, was related to the lesion's radiographic appearance, but not to the participant's age or the study tooth's preoperative sensitivity. The implications of this study are that on the basis of low level of rapidly progressing dentinal caries in the study population, and the fact that slowly progressing caries can be inactive or remineralizing, the authors advise sealing versus operative treatment of early or shallow occlusal lesions. As a PEARL practice-based research practitioner, I participated in this study, and I have incorporated the results of the study into how I practice dentistry. For more information, please see the full study findings in the manuscript Dentin Caries Activity in Early Occlusal Lesions selected to receive operative treatment, findings from the PEARL network, in the Journal of the American Dental Association, Volume 143, Issue 4. It is the April 2012 Journal of the American Dental Association. Thank you.